stuff this is in your way. So, it's color coordinated just like your white ones for film. So you have the same cheek retractor. I don't know what she calls it, but you have your yellow, you have your blue. These all go together with the double. You always want the flat part facing your patient, so nothing changes when it comes to placement. Everybody with me so far?
Yes.
Okay, these three go together. Just like this, it's straight, this is straight. So don't let the difference of the holders throw you guys off. It's the exact same thing, okay? Just like with your bite wings, they're gonna bite on this. The flat part of the sensor goes towards the cone. Okay, so just like the white part faces you, this flat part faces you.
So the cord is
The
lingual?
cord is always lingual and it comes out of the mouth. So you don't want to place it inside the mouth like this for an upper.
Right.
Okay? You want it coming out of the mouth, one, because it'll choke them, two, and they'll bite on it, and then it'll ruin it. It'll slide. And it will only fit one way, you guys. If it's coming and it's fallen out, then it's probably placed wrong. Okay? Then take the x-ray and it'll come up on here. This, it clears it as soon as it images it. So you can just keep taking them. Make sense? Okay, so that's your digital. All right, it's finally loaded. All of you are going to be new patients. So you're going to go right here to new patient. How I do my classes, I want your last name, your first name, and whatever Dexter you are using for your middle name. So that way we know that this is always going to be, whatever. Which one is this?
Magic Mike.
So always Magic Mike for digital. Okay? And then once you click on it, I'm not going to make a new one.
Wait, could you say that again? What?
Sure. So you're going to go right here where it says new patient.
Mm-hmm.
Okay? It says last name, first name, middle name. So I want Mila, I want your last name. I want Mila here. And I want Magic Mike as your middle name. I'm renaming you all. Magic Mike. Okay? Don't worry about social security, birth date, none of that doesn't matter. Okay?
Not for our patients either?
Your patients is going to be different. I want their last name, their first name, your name as their middle name. So you're seeing John Smith, so it's going to say Smith John Mila. Mila's going to have a female middle name. That way I can, if you're not here and you call me, can you print it? I can find your patient.
And then provider?
And then nothing else needs to be, no. If you want to put male, female, that's fine too, but you don't need to do any of that.
Okay.
All right, so I'm just going to pick a person. This is what I was talking about in lecture, how it takes a long time. So this takes a good 5 minutes. This green has to go all the way to here. So this is what we were saying in class, that do this first. If you're going to start digital, you put in your name, you pull this up, and then you start setting up Dexter, getting your thing. So by the time you come back, this is ready. Same for your patient. You know you're going to be doing digital, you put your patient in, you put everything, get it ready. That way you and your patient aren't going, so, how's the weather? Because they're just wasting time, okay?
Okay, can you show me one more time how you got these x-rays up? You just click the patient?
I just clicked the patient's name. The reason why there's x-rays here is because I picked a patient who already has had x-rays. Yours will be blank.
We have to put the own format?
It does it for you. I'm going to show you right now. Now, let's say you guys are doing the 10-minute intervals like I was telling you to do. And so now Kathy's time's up. It's Mila's time. She's like, well, what do I do with my x-rays? You exit out. Whatever she's taken pops up. So you know where you've left off. They save automatically most times.
So you don't have to click like
You don't have to say, yeah, you don't have to click save. You don't have to click anything. You just exit out. When you pull your name back up, they'll be there.
So in
They
those
should
are
be.
shot, like you already have selected that you're doing the maxillary right molar
It does it
shot,
for you.
so it
Okay,
does
so
it.
this is going to answer your question. Okay? You guys are going to have a blank screen. You're going to go to the radiation sign. It's not going to let me do it because I don't have my sensor plugged in.
Oh, it popped up.
Hold on, let me show you. So the sensor goes down here, you guys. Okay, just in there. Yep. Make sure the default on some of these are digital, some of them are film. Make sure it's on digital. You guys know how to change this over here, right?
Yeah.
Okay. Please be very careful. This thing is $10,000 and it's our last one. So, this is all of your teeth. You guys are going to go right here where it says full mouth. It starts you up at the upper right. Okay? Does it tell me? Okay, I don't have it. Anyways, so you are going to start the upper right. Now what it does is it starts upper right, brings you to, so you're going to do molar, bicuspid, then it drops you down to the lower left. The reason why is because you don't have to change your holders.
Right.
Okay? Follow these tooth numbers, you guys. These are tooth numbers up here. So it's going to have you do yellow first, then it brings you to blue. Blue starts you off at 5, 6, 7. If you guys have done all 8 yellow, then you guys need to know that your next step is blue for your 6 anteriors.
And then your bite.
Okay? Then it does bite wings last. Again, it does bite wings here. Then it does molar,
Your molar.
bicuspid on the right side. Then it jumps it to bicuspid,
Then molar.
molar.
Right.
Every single one of my students in every single class I've had always does molar, then bicuspid, then I have to flip it. Okay? Do not, if you don't like an x-ray, don't keep retaking it. Wait for one of us to tell you it needs to be retaken. Do not delete x-rays. Do not, because they're always going to be in here, and I don't want you guys getting used to that. So what it'll do is if you see here, this person has taken several x-rays. So it does from its most recent and then back. So they're all there, and that's okay. When I print, the most recent will come up, okay? But I need to know how many you took and why. What do you need to work on? Is it your angle? Is it getting it centered of the film or whatever? Okay, any questions about digital?
One more time. So you said
So you're
when
gonna
we
go
print
to
it-
here.
When we print it, it's gonna come out.
When you print it, let
Yes,
us
sir.
do it. Because if you guys just put print, it puts, it's one x-ray per paper. So we're wasting film and we're wasting paper. Not film, I'm sorry, ink.
Right.
Okay? So let us do it. If, and I'll run it with Dr. Vora. You guys won't be ready to print anytime soon. Probably tomorrow, and Mrs. Navarro will be here, okay? So any more questions about digital?
Can they see how it's proceeding? Like when the yellow does it, can they
Yes, the
see it?
yellow will move.
Yellow will move?
With the teeth numbers that are next.
Okay, okay.
It's all automatic. You should never have to touch this unless you get stopped. Then you have to just go back, and then it tells you right here. When you push full mouth, it says next or back. So if you come back after your 10 minutes, and then now it's Ashley's turn, Ashley's done, then Mila comes back in, then she just has to go next until she gets where she wants to be, and then it'll run the same, go in order. Yep,
What if
same
they have to
queue.
retake, like let's say number 2?
If they have to retake,
How
then
do
they just push the numbers they need.
So how, like, do they go to number 2? Like, let's say if they have to retake, they just click there?
Yeah, they just click the teeth
Number
numbers.
2, okay.
Wait, we wouldn't
When
have
you
to change
print
the
it-
patient?
Okay, hold on, no. When you print it,
Yeah.
the teeth numbers are on here.
Yeah.
So you will know what you need to take. Okay? So if I say, oh, Ashley, you need to retake your bicuspid shot, she's like, well, I don't know what teeth numbers are. It says right here, 3 through 5. So she's going to click 3, 4, 5. And then it'll just pop up right here. Students get carried away and they just do whatever they want, and then films are all over the place. So make sure you're following in this order. Know your teeth numbers, you guys. Okay, are we good with digital?
Yeah.
Okay, let's move on to bisecting. Where's bisecting set up? Nowhere? Okay, then let me get that set up.